Temporomandibular joint dislocation. Definition of temporomandibular joint dislocation. Dislocation of temporomandibular joint is defined as displacement of the intact condyles past the articular eminence, and there is inability to return back to its normal position, which must be manually reduced. Causes of acute dislocation. There are two types of causes of acute dislocation of temporomandibular joint. They are extrinsic or iatrogenic causes, intrinsic or self-induced causes. Extrinsic or iatrogenic causes 60%. They are trauma, injudicious use of mouth gag during general anesthesia, excessive pressure on the mandible during dental extraction, intrinsic or self-induced forces. 40% of acute temporomandibular joint dislocation, excessive yawning, vomiting, singing loudly, blowing wind instruments, laughing loudly, opening mouth too wide for eating. Clinical features of temporomandibular joint dislocation: inability to close the jaws, pain in the temporal region, and profuse drooling of saliva. Movements are restricted, anterior open bite. Diagnosis: history, clinical examination, plain temporomandibular joint view, plain and contrast CT scans, CBCT, MRI, 3D CT scan. Management of acute temporomandibular joint dislocation. Treatment of temporomandibular joint acute dislocation should be started as soon as possible. If we delay about treatment of acute temporomandibular joint dislocation, muscle spasm and fibrosis will be occurred. Reassuring the patient, symptomatic pain relief with analgesics, tranquilizers, or sedative drugs. Pressure and massage the area, and manipulation.